just a little bit. Last time you were here, you talked about findings from your RAISE study, recovery after an initial schizophrenia episode. You've done some work since then. What have you found out? What have we done to translate those findings into practice?
Right, so RAISE, Recovery After Initial Schizophrenia Episode, was a program in 36 sites across 22 states, community sites, to try to understand whether we can do better with what we know today. So taking a whole range of interventions from medication, family psychoeducation, providing what's called resilience training, looking at both ACT teams and supported housing, supported employment, all of these things that we've known about for years, putting them together in a package and then delivering them. The results for the primary outcomes were just published about 2 weeks ago, and they're very positive. It looks great. The most disheartening part of that story was that amongst the nearly 400 subjects that were part of this study, the mean duration of untreated psychosis was 74 weeks, which is just stunning. It's hard to believe. So what we're doing now is moving this forward into communities, working very closely with SAMHSA. Kind of mentioned the importance of putting this, what's now called coordinated specialty care, into the state system. It's part of this mental health block grant add-on. There are now 32 states that have programs based on this, and we're looking to even expand it further through something called the Early Psychosis Intervention Network, which will create a learning healthcare system that will actually allow us to have a single electronic health system and a coordinated care effort that can incrementally improve as we go. So it's a high priority for the Institute, high priority for SAMHSA. It's a great story of teamwork across the agencies as well.
You referred to your BRAIN initiative. What are the most significant findings so far there? And is this part of the overall BRAIN initiative that Dr. Collins has talked to us about at NIH that he hopes to be able to do?
It is. So Dr. Collins we sometimes joke he's become a born-again neuroscientist, that he is though he was trained in another area, he's discovered how spectacular neuroscience is today, and that of almost any area in science, this is a place where we have so much traction and so much excitement. The BRAIN Initiative, launched by the President in April of 2013, has moved forward. We're now have funded our second year, about $84 million that we've invested for over 100 projects across the country. And what we're...
Just within your agency or the whole, or the entire?
The 84 million is NIH alone. There are 10 institutes within NIH that are engaged in this. Dr. Walter Koroshetz and I lead it. Dr. Koroshetz at the Neurology Institute, myself from NIMH. So it's a partnership, though, with DARPA, with FDA, with IARPA, and with NSF as well. So there are many different federal agencies involved, lots of private partners. Important thing to understand here is it's really...
84 million, the total funding, or just the NIH funding?
NIH funding in 2014. That's where we're up to. The President has asked that would go to 150, and I think that both in the House and Senate, there's an ambition to go way beyond that as well for next year, for 2016. This is not about the specific diseases or brain disorders. It's about developing the technologies to be able to understand how the brain works. And we're seeing already fantastic tools being developed across the country without wanting to say too much about it at this time, but there's a group in Seattle at the Allen and Brain Institute that has really, I think, opened up this whole field for all of us in a way that gives us the excitement that over the next few years, we will transform the way we study the brain.
Thank you. Senator Murray.
Well, I'll just follow up with that. So